Hello, and thanks for joining us for this video case tip. I'm Bryn McBride of ABC for Health. Today we're asking the question, are grandfathered plans still a thing? We'll answer that question and give you some history. But first, we do have some resources associated with this webcast that you can visit at any time by clicking on that information button you see at the bottom of your screen. Are grandfathered plans still a thing? Yes, they are. What are we talking about when we say grandfathered plans? Well, these were insurance plans that were in place before the Affordable Care Act was signed into law. There was a provision of the Affordable Care Act that allowed insurance companies to keep offering these plans as long as they didn't change anything moving forward. And we'll talk about some of those elements in just a moment. But what do we think about grandfathered plans? Well, they're typically worse plans that are a little bit more expensive. They do not allow the same rights and protections as the plans offered through the Affordable Care Act. The biggest one is they do not have to cover pre-existing conditions. So these are plans that are following a lot of the rules that were in place before the Affordable Care Act was signed into law. It was kind of a concession to appease some of the insurance industry. Now, and these plans have to stay largely the same from year to year, but they can charge higher premiums and they don't have to offer the same protections. So this is why they have gotten kind of a bad reputation and why they've been so discouraged. But are there still some of these plans out there? Yes. The patients that we've talked to that have these plans are paying a fortune for their coverage. It is not covering their pre-existing conditions. It is not paying for preventative care. They are not following rate review laws or medical loss ratio, which means that the plan doesn't have to spend your premiums on your care to the same degree that Affordable Care plans have to, and that they can put yearly limits on your coverage, unlike Affordable Care plans that cannot. So these are definitely still a thing. A plan can lose its grandfathered status. So say you had a plan in place in March of 2010. It got grandfathered in after the Affordable Care Act was signed, is still being allowed to be sold. A person might have had the same insurance for the last 7 years, but if that plan were to significantly cut or lower coverage or raise coinsurance, co-payments, deductibles, significantly lower employer contributions, or add or decrease a yearly limit on what the plan pays, they would lose their grandfathered status. So these are ways that most plans have filtered out of being able to be being sold that had originally been grandfathered in once the Affordable Care Act was passed. Now, will these plans last forever? No. CMS, the Centers for Medicare and Medicaid Services, has been renewing the ability for plans to be grandfathered from year to year. Right now, that last extension is scheduled to end on December 31st of 2018. So there really is 1 year left on these plans as they're available. Could CMS extend that? They really could by rule one more time. Or they could set an indefinite calendar renewal on this. Right now, the rule is written that these plans will sunset at the end of the year in 2018. It's a date we're looking forward to get some of these bad insurance plans off of the market. You can read more about grandfathered plans right from healthcare.gov. CMS and HHS address this topic directly. If you have other questions, you can certainly give us a call and we can talk it over. If you're watching us on YouTube, you can like this video, share it, or subscribe to our channel. Thanks for watching.